Hi, everyone, and welcome to this session on the Back to Work COVID-19 checklists. My name is Amanda Hatherley, and I'm the director of the Energy Smart Academy in Santa Fe.
My name is Janet Curley, and I'm an environmental health and safety instructor at Santa Fe Community College, and I'm a part of this team too. And
anything else, Janet?
Nope. What else should I say?
My name is Rebecca Young-Eckman. I'm the Special Projects Manager at the Energy Smart Academy at Santa Fe Community College, and one of the primary developers behind the COVID-19 workplace safety course and checklists.
My name is Troy Kuchera. I am the state representative for New Mexico, the grantee, and I've been with the program, the weatherization program, since 2006, and I thoroughly enjoy what I do, and I am looking forward to seeing how we are going to make this work as a team with our current challenges.
And I'm Rob Foley. I am an energy auditor and QCI inspector for ICAST. We're one of the sub-grantees in New Mexico. So we're the boots on the ground trying to put these checklists into actual implementation.
So back in maybe beginning of April, when we were all on lockdown in New Mexico, Troy approached me and asked if we could come up with training for his crews, or the crews in New Mexico, who were going to be at some stage when we got out of lockdown, back trying to deal with going into houses with COVID-19 around. And so I talked with the great team we've got, and we decided to come up with an online course that people could take from the safety of their homes. And then once we were going back into the field, we were going to do field training. So for about a month, there was this mad scramble with Janet and Becca and another coworker, Jeffrey Granger, and myself, putting together a COVID-19 workplace safety course, which was rolled out in the middle of May. I think as of now, maybe this is being recorded in the middle of July. We've had maybe 2,000 people go through it from all around the country, and we've had great feedback. Based off that course, we were also asked by the Building Performance Association to develop checklists for people to use when they were in the field. And these would be checklists for the general managers of a program, for office staff, and then for all the different people that work in the field doing energy efficiency work. So we completed those recently. That's what we're going to talk about on this call. But I wanted Janet first to talk about some of the regulations that we had to take into account, obviously, when we were developing our training, and then also the checklists.
Well, thank you, Amanda. One of the most difficult tasks that we've had in this pandemic is getting accurate and useful information. So we have relied primarily upon the information coming out of the Centers for Disease Control, CDC, and Occupational Health and Safety Administration, OSHA. And one of the major first confusions is who is responsible for giving us accurate or useful information. So the Centers for Disease Control gives information for the general public, but OSHA is responsible for giving us information about worker safety. So when we are putting a return to work program back together, we utilized information from the Centers for Disease Control, World Health Organization, and numerous other public sources of information, and used the guidelines within the OSHA return to work guidance to put this training together. But we also utilized our expertise across the team on putting the information together so that the information is presented in a context that makes sense to each of the workers in each of the modules, and presenting that information so that it can be put into the long-term memory, or also make sure that they understand why each of these segments of the work and requirements of the return to work practices and protocols are important for protecting both them as a worker and our clients as they go into their homes. And from our hazard assessment and our looking at the various return to work programs across the United States, we put this training together and the checklist from that.
Thanks. And Rebecca, you're now going to be showing us some of these checklists, right?
Well, I wanted to add in addition to using the CDC and OSHA as significant resources, we've been using some medical resources, including the New England Journal of Medicine. Johns Hopkins Bloomberg School of Public Health has had substantial impact upon our research, their resource center, and also they have a podcast, the Public Health on Call podcast, that has come into play quite a bit. And we've relied a lot on industry resources as well, such as ASHRAE. The International Society of Indoor Air Quality and Climate did a whole webinar series dealing with issues in and around COVID, including a particularly good one that had to do with UV germicidal irradiation that I strongly recommend anyone who's considering going that way to look up that one. In the actual bundle, we include a COVID-19 fact sheet. This is available both for employees and contractors and for clients, for anyone that you think might be able to use the information. Goes over symptoms, testing, transmission, and contact tracing, which is becoming more and more an important part of fighting COVID-19. This is a checklist that specifically is for management. It focuses on things to look at within your building and within your procedures and protocols in your office before bringing before bringing employees back to work, but also throughout your work, and has several different sections to it. We have a checklist that addresses if and when an employee contracts COVID-19, how to start to implement cleaning and sanitization within your office and start notifying local public health officials, as well as one that has to do with if a client contracts COVID-19. We have a list that has to do with this is what I do when I record the classes too. I start to say things and I stop. We have a list that has to do with in and around the office. So this addresses just general protocols more than anything else. And then a separate one, here we have a delivery person and visitors sign-in sheet, just an example of one. But we have a separate checklist that specifically is a daily checklist for in the office, including procedures for when you first arrive at the office, throughout the day, when you go for lunch, and I believe there's one further down that's for toward the end of the day. Yeah. Another one that's suggested intake questions for when you're interviewing clients in preparation for potentially going out to do field work. One that is assessment considerations, specifically auditors and assessors, particularly addressing the remote options for trying to do assessments before going out to the home. This is our job hazard analysis matrix, which Janet will probably happily talk about at some point here, but a very critical thing for addressing the risk that we're all facing when we go out in the field, not just in COVID-19. Client home procedures, this one specifically looks at it from an assessment or inspection viewpoint. A fieldwork checklist for before heading out into the field, including opportunities to write down the various work tasks for the day and address what tools are going to be needed, equipment, and PPE. And then another checklist as part of this for making sure that within whatever vehicle there's the appropriate PPE and cleaning and disinfection supplies, so that you know that you have them before you leave the warehouse. And this one includes a nice spot for the crew leader to have to sign off, or whoever the vehicle driver is to have to sign off to say that they made sure that you have everything you need. Then a client home procedures for the crew. This one's a little bit longer. Inspection considerations. and end of the day procedures for anyone who's been out in the field, including stopping by vendors and what to do when you return to the office and even when you get back home. And then finally, included in the bundle, of course, is sources for all of these handouts to show the research that's behind it to back up what we're asking people to do. I believe that's it. Is there anything more you wanted me to talk about, Amanda?
I think it's critical to point out that we based everything we were doing on recognized public sources rather than myths or rumors or things that people are hearing, because those are rampant across the internet and through various resources. We wanted to make sure that everything we were asking people to do could be traced back to a reliable document, source based upon scientific information or current information, and recognizing also that that is a moving target with the ability for us to update on a regular basis as information changed.
And Janet, do you want to address that job hazard analysis sheet right now? Maybe Rebecca could pull it up.
Certainly. OSHA is requiring things from employers, and the first thing that they are requiring, no matter what you do, is to do a hazard assessment for your employees. And from the hazard assessment, you put together your return to work plan. From a compliance perspective, if you haven't done your hazards assessment, then the regulator will go to your return to work plan and determine if you are following what you said you would do in your return to work plan. So it's really important for everyone out there to understand that especially with respiratory protection, OSHA is being flexible during this pandemic timeframe due to the problems with getting respiratory protection equipment, or PPE as everybody refers to it. There's more to PPE than just respiratory protection, but they want all employers to look at where are the potential exposures to the employees and how are they addressing and protecting the employee from those potential exposures. The job hazard analysis that's up on the screen is a very common job hazard analysis that is done across all jobs that we do in business and industry and construction. You can see that it provides the employer an opportunity to identify the activity, who prepared it, identify the job steps, identify the hazards as the job progresses, and then gives the employee an opportunity to say, how will I eliminate these hazards through either engineering controls, work practices, or the use of PPE. What is not commonly on some of the job hazard analyses, but is increasingly being required by OSHA, is the Risk Assessment Code, the RAC. And this is a code that is put at the end of each step, where you've identified the hazards, so that the employee can connect. If I don't do this, these are the potential severe outcomes that could come from me not doing this. This is what we call putting the information into context, or I like to call it linking the dots together. Yes, I know how to do my job steps, but do I know that the hazards are changing every time I change the step in the task that I'm doing? And do I understand that I have to maybe sometimes shift what I'm doing to control or eliminate those hazards? And then if I don't do it, what's the potential outcome? And the severity outcomes are catastrophic, which when we are talking about a situation like what we're doing right now, if one of our workers is infected and comes to work, it could potentially be catastrophic under the current conditions. There's also critical, which would mean hospitalization. Marginal means first aid, means that someone goes to the hospital but then comes back to work that day or the next day. And negligible is basically first aid. And that's how we use these risk assessment codes. OSHA has identified that the work that the weatherization that we've identified from OSHA's categorization of the work, that since we are not in medical exposure levels, that the work is either moderate or low risk. So that's the thing that we keep emphasizing to all of the workers in the training, is that we are not in a medical condition situation, but we are still in a severe contagion situations, and develop the procedures and the return to work plans to address those exposures and minimize those risks. Was that a good enough explanation?
Yeah. Thanks, Janet. So now what we were going to do is go through a few of the items on the checklist that Troy and Rob have identified as ones that maybe people might want to think about or talk about, and we're going to discuss it as a group. So Troy, why don't we start with one of yours?
Okay, sure. I figured that we would start with the assessment checklist. I'm not sure if we want to bring that up on the screen or not. On that checklist, the client home procedures for the assessment, there is something that talks about setting up the visitor contact tracing list. And I think that's super important. However, this is one of those things where we can almost have like this picture perfect advertisement idea in our mind, where you see the commercial and everybody's got the masks on and you can see their eyes smiling and everything is flowing as it should. And then when we get into actual practice, there are problems. And being out there with weatherization, everybody knows that things just don't flow the way we want them to flow at all times. So my question is, with this part of the assessment, and that'll be circled back around to the final inspector, by the way, what happens if things don't go as planned? So an example would be the assessor sets up this contact tracing list, and that stays with the client throughout the process. And as the folks are working on the home, several visitors show up because they want to check on mom, as they should. However, they're just not really wanting to sign that list, and they're having a very hard time understanding why they must sign that list. And the crew leader ends up spending more time trying to get them to sign the list than they do in their own job. How is this enforced? What are some ideas that we can offer the network that would help the teams enforce this, or maybe not, enforce is not the best word, maybe be successful with a good contract tracing list?
Would you like me to go for that one? Okay, so Troy, one of the things is, if in contact tracing, the contact tracer will ask the person, who have you come into contact with? And this list can be used for that. Now, I wouldn't have the team leader or the project foreman spend a whole lot of time on this, because we will have our records as to who was present, but it'll be the client's responsibility to give the information to the contact tracer. And if they say, my husband came, my nephew came, that'll be their responsibility to report that information, not necessarily ours. We will have our records as to who was at the job site while we were there, but it's really not, we're not assuming responsibility in contact tracing for the client's contacts.
Okay, that's good to know. So a scenario, a typical contact tracing scenario would entail, I'm guessing that the person who is working at the job site is positive for COVID, and that client is contacted by the contact tracer. At that point, the client would be the responsible entity to provide the names of whomever had visited that job site during that period.
Correct.
Is that correct? Okay.
Yeah, and we have our list of who we brought, and and if you wanted to add that, Mary's husband came home for lunch, which was a situation we had down in Las Cruces, they could do that. They don't have to be specific. That's going to be the responsibility of the contact tracers to trace down those individuals. As long as we have our record of who we brought to the site and who was at the site while we were there, we're keeping our records. It's the client has their own social responsibilities. And if they would probably in a contact tracing say, oh, well, ICAST, I'm just using you as an example, Rob. ICAST showed up and did this work at my house. The contact tracer would contact us. We'd pull out our list, and then it would be the contact tracer's responsibility to contact individuals.
I would also toss in there, usually the contact tracers try to specify how much time different individuals had in the same space, whether they were less than 6 feet, whether there was PPE involved, specifically respiratory PPE in this case. So not every time that you pass a person is considered to be a contact as far as contact tracing is involved.
Yes,
it has to do with
it's more than 10 minutes.
Each state is a little bit different, but I know 10
Yeah.
minutes is the absolute bare minimum. It has to do with the threshold of time. It has to do with distance. It has to do with the type of contact. I mean, obviously, people that you share a house with, even if you're not, directly in the same space with them all the time, you're in the same household with them and for long durations. That's an obvious contact. Somebody that you talked to in passing when they were coming in to visit their mom and they stayed inside while you were outside doing work doesn't necessarily qualify as a contact.
So I have a question. How are the different states communicating to the virus that they can, depending on which state they're in, how communicable they are, right? So in some states, it's 5 minutes. Other states, it's 10 minutes. How are they managing to do that?
That's a good question, Rob. I don't have the answer to that, but that's something that I would imagine we'll gather that data eventually. We're still very new. If you think about it, there have been some states who have not actually closed, and they stayed working all the way through, and some closed down shortly, some closed down for a longer period of time. So eventually we'll have that data.
Could I also put in that there's like 2 or 3 different areas where there might be potential liability. For example, if we are screening our workers before they go into a client's house, and when they are there, they are wearing respiratory protection of some sort, preferably something that is approved by OSHA in terms of respiratory protection. In the event that we bring it in, so we will have a case that we have followed all industry practices for preventing the spread of COVID into that environment. It would then be the other person's responsibility to prove that we did bring it in spite of our practices. So if we are following our practices as they are stated, we have minimized the risk to the lowest level. And that gives us some protection from the client saying that we gave it to them. But from our own employees' perspective and the potential workers' compensation issues, as long as we are also documenting that we are minimizing the risk of exposure to our employees from both our clients and from other coworkers, so that in the event that someone does get ill with COVID and had to put a workers' compensation claim in, that we would be able to present information and evidence that we had done the best, according to best industry practices to protect the employee. And so it would probably be from, say, maybe some other source, not strictly work related, that workers' compensation courts would take into account in assessing the business's liability for workers' compensation to that employee. And it's not our responsibility on the contact tracing. That's a whole nother governmental Department of Health issue that we're just trying to comply with. So if they contact us, we give them information. But to think that we just have to collect the information and as their procedures evolve, as they go out into the field, we will have documentation that'll meet, as far as we can tell, most of the information they will be asking.
Thank you.
Very
Those are
good.
good answers.
Great answer.
So Jana, for this question, I'm going to talk about a job hazard analysis, but I want you to talk about it not so much from a regulatory standpoint, but from how it's an effective tool to actually reduce risk and injury. I think that's something you covered really well in our OSHA 30 class.
Okay.
So let me ask the question.
Yes, ask the question.
Okay, so Janet, you're just killing me with all these forms, right? I mean, you make me fill out this job hazard thing on every job as soon as I get, I'm not going to have any time to do any work because all I'm doing is filling out forms. Why do I have to do this?
Okay. So first of all, I use the job activity or job hazard assessment fulfills several different functions in any kind of a project. Number one, I use the activity hazard assessment. I have the employees fill it out, because then I know that they know what the task I've assigned them is and what the steps are. And many times one of the things that really impacts the efficient and effective completing of a task is people stand out there going, oh, I don't know what we're supposed to do next. When you put the job hazard assessment together, they know from the get-go and they have put it down and you have reviewed it and you've all agreed these are the steps we have to do. But they take the form to the field so that if it changes, because in the world we live in, there's a lot of variability. So we use the form to make sure everybody is in agreement what we're going to do when we get out there. It also helps me understand where I might need to do some additional training in terms of job training with people. It also serves the purpose that when I get newbies, new people, new hires, I can pull these forms out and say, this is how we do these types of tasks. We don't care how you did it at the other place. This is how we do it. So it's an agreement that how the task is going to be done. It's an agreement. It's useful as an on-the-job training tool. And then third of all, it gives me a list of the equipment I need to make sure I have in that vehicle, because if somebody leaves the right type of ladder, that's a 2 to 3 hour mistake, which is a killer to job efficiency and effectiveness out here anywhere in the country, because someone's got to get in the truck, go back, get the right one, come back. Or worse, they will try and jury rig or make something work that's not safe, and then that increases the risk or the likelihood of having a job accident. And that's what we ultimately want to protect people from. And then I also use it to, the fourth way that we use the activity hazard assessments or job hazard assessments is to review periodically and write our written procedures, which is something, and our policy manuals. And once I've collected enough of those over time, I can see, well, how specific or general do I have to be when I'm doing my written procedures, which is something most employers should have in place. Did that answer your question? Or you want me to keep
guess.
Okay. It's a multi-use tool that tells me what I'm working with, okay, in terms of people, equipment, their knowledge, their understanding of what they're up against and the types of hazards that they're facing and how to protect themselves. That I can, then it's documentation that I can use for additional training, on-the-job training, or revising my policies and procedures.
Very good.
Great. So, Rob, do you have a checklist item that you want to discuss?
That was my first
okay.
one.
That was your first one. Okay, let's go back to Troy.
Okay, very good. I'm glad that Rob had mentioned the job hazard analysis. I think that is extremely important to focus on this particular item. I also have a question about that. We know from experience that at times we fill out the job hazard analysis, and when you do the final inspection, we find that something was not addressed. Pre-COVID, the way that was handled was we train. We talk with the people that were responsible for not implementing that safety measure, and we're very glad that nobody got hurt this time, but you may not be so lucky next time. That's said and done, and we move on, and hopefully that mistake doesn't happen again. Now that we're dealing with this different kind of a monster, if something happens to where, let's say the client was experiencing symptoms, and that was listed on the job hazard analysis, and for some reason their work proceeded anyway, it fell through the cracks for whatever, there's a multitude of reasons that things happen in weatherization, as we know. There's no excuse for that happening, but we do know that if the if there are enough homes weatherized in the course of a year, at least nationally, we're going to encounter this at some point. What would be the next steps? We can't just say, well, let's train and talk to them and everything's going to be okay. Now we have something that is much bigger. What would be the best way to deal with this as an agency and as individuals?
Let me first address that if you are following the COVID safe work practices that we have identified and we have trained people to, even if someone is there with COVID, they are still safe as long as they follow the social distancing, washing their hands, disinfecting their equipment. That's what, that we are not putting people through all of this respiratory protection and all of these procedures because there's no one in the house with COVID. We're putting them through there in case there is COVID present. And that's the thing we have to make sure people understand. There are many pre-symptomatic, asymptomatic. Geez, there was like 4 or 5 different new titles that are out there that the World Health Organization is putting out this morning and the last 2 days. So that's why we're using these protective measures. I also want to put out that there are cooties out there in the workplace that anyway, okay? And some of the other hazards or risks that work weatherization people are encountering when they go into these homes is mold, mildew, other kinds of what we call bacteriological or biological hazards. So we've had other work practices in place to protect them even if there wasn't mold present. So please remember that. We've been doing this all along in the 9 years that I've been with your weatherization program. So back to your question, as an agency, if they implement these safe work practices, what's wrong with that? Okay, we are protecting the workers and the clients.
Thank you, Janet. So the general safety mentality in that case would be to work as though the clients are positive
Correct.
with COVID, and also work as though you are positive with COVID.
Correct.
In fact, we kind of ran into that with some of the crews where they talked about this idea of, let's say they got tested, right? And they said, well, I got tested and I was negative. My partner got tested, he was negative. We're good. And it's like, no, you're not, right? That we have to kind of emphasize that, because that can become kind of a misnomer that, testing is useful, but testing is no proof that you are safe or that anybody else is safe.
And there's been plenty of negative tests. There's a lot of information out there that negative tests are coming back from people who are in the hospital right now. So that's one of the moving targets that we have to emphasize to the workers as well. Rob, I was doing the hands-on portion of this training earlier this week, and we had some student workers. And when I first got to the job site, they were not practicing social distancing, but by the time I got done with them, they were staying 6 feet apart and wearing their masks because they just didn't have enough information. And these were people who were very young. And I think that's the important part that we're missing. When we give people accurate, up-to-date information, they will use it. If they don't, then that gives us an area to work on the overall safety culture, safety attitude.
Thank you.
I don't know.
Yeah.
Should we take a moment to clarify the difference between the 2 different types of testing?
Good point.
Or do we not want to get into that in this call?
No, I think that'd be great. You want to take that one on, Rebecca?
Go ahead, Rebecca.
So the key to remember is that testing is a snapshot in time, especially when it comes to the PCR viral swab testing that they're doing that looks for active infection. So you can have a swab taken at a particular time on a particular day, and that can come back negative. There's also a high incidence, it seems, of false negatives when it comes to that particular type of test. But all that is saying that at that moment, you were negative. That doesn't correspond with what you did the rest of the day, when you went to the grocery store, when you were shaking your neighbor's hand. All of those things play into whether you are still negative. And that's particularly the viral testing. It's a swab that they usually actually stick down your nose.
It's not that bad.
It's not that bad, but it's not comfortable either.
Oh, sorry, poor baby. Your comfort in a pandemic's real important to us.
I got 2 kids. I'm trying to prepare for all this. So,
okay.
It's a swab, and it specifically is trying to get that respiratory fluid, the droplets that we're so afraid of, that everybody's trying to protect themselves from. That's what they're trying to test, and they're testing for whether the RNA of SARS-CoV-2 is actually in that mucus, that respiratory fluid. That's one type of test. Then there's a separate test, which is the antibody test. That's a blood test that will not show the presence of antibodies until after you have been infected with SARS-CoV-2 and have developed antibodies to it. And so that can take, the full incubation period, the full infectious period, and through recovery before those antibodies come up. So if you have a positive antibody test, what that shows is that at some point in the past, you were infected with SARS-CoV-2 and you have developed antibodies to it. It does not pin down when you were infected with it, and it does not necessarily say that you are immune to it in the future. All it does is show, again, that at some point in the past, you have been exposed to this and you have developed antibodies to it. So 2 different tests, 2 different methods, one that's testing the fluid, the other one that's testing blood, and giving 2 very different sets of information.
Yeah, and I'll just reiterate that the first test is a test that tells you at that moment of time how you were. It doesn't say whether an hour later things have changed. Right. The second test says that you have at some stage been in some level of contagion, I guess, with COVID-19, but
infected,
but it also does not necessarily mean that it's a get out of jail free card, because we don't know yet whether you can be reinfected. In fact, there are some people who have shown reinfection at a later date.
Right.
Is that correct?
That's the moving target in this whole thing, which is why we have, as Troy and Rob already mentioned, we assume everyone is infectious and we protect people at that level. And until we get through and the medical community gives us better information or a vaccine or herd susceptibility has developed, all of these things take time in any of the pandemic situations, not epidemic situations.
So Troy, give us another of was it your turn or was it Rob's turn? It's Rob's turn.
It's Rob's turn.
Okay, Rob.
So you have these 3 things on the checklist that seem to me to be kind of hard. Be alert to occupant health behaviors without prolonging interaction. If respiratory issues arise among occupants, contact office to determine next steps. If symptoms arise within one of the crew members or yourself, contact office to determine next step. What are you talking about there? Am I supposed to be the doctor for my clients while I'm doing all this work inside their house?
No, not the doctor, but you are observing the situations that you're putting your employees into. And that's what you're doing. And if you have any question that someone doesn't have allergies and, the protections that you have put in place minimize the risk of exposure to your employees, even if someone sneezes. And we have also additional protocols for people to do another step of decontamination or, to transfer that information back to the office.
Okay, that makes sense.
Any other comments?
We're trying to be proactive.
Right.
We're trying to be proactive and stay in front of it rather than realizing, 5 days later, 2 weeks later, and that makes the contact tracing that much more difficult. And you've already got people who are infected at that point.
In fact, I think one of the hardest things to do or to be successful with here is getting clients to wear a mask in their home, right? That and yet that's going to be a key to success, I think. If we're assuming that we've got COVID and they've got COVID, we better be wearing masks, and that's going to be a heavy lift.
Okay, you have alternatives. Okay, the mask does not protect you. Please understand that. Social distancing is what protects you, and washing your hands when you've touched a high viral dose, a high contact surface, and not putting that to your mucous membranes, your eyes or your nose. So please understand, it isn't the mask that is protecting you. It is the distance that is protecting your people. So if they are in a house where someone refuses to wear a mask, if they put that person in another room and maintain the social distance, they can still do the work, even though the person might possibly be COVID positive or, pre-symptomatic, or whatever the word they're using this week.
Right.
Does that make sense to you? Another suggestion we've put up is to contain the looky-loo situation is to take a 3 mil plastic and put it up on the door to prevent whatever dust or anything you're doing in your area you're working, and to prevent the person from walking in on you and then potentially sneezing or coughing in that area. So we've built into these checklists and the operating procedures things that will protect your people. We're not relying on one thing, and that's the biggest mistake I think everyone is out there. The biggest misconception is, it's the mask that's protecting me. The mask is not protecting you. The mask is preventing you from spreading the virus way out. And if you look at any of those little videos of people breathing and spreading stuff around, it's pretty effective. It's pretty convincing as to what the mask is actually doing.
Mm-hmm.
So emphasize social distancing and keeping the people in another room.
Very good.
And then decon.
Okay, Troy.
I actually, before I asked my question, I wanted to continue with this same thought process. And that is the social distancing and the masks in relation to outside versus inside. So if somebody is standing next to me 3 feet and they have no mask on outside and we're putting in a window, and that person is there for about 5 minutes. You had mentioned something about 10 minutes earlier. Would that still apply? Would we still be okay with that situation because we're ventilated?
We don't know the correct answer to that yet. We think the CDC and are giving us information that if I'm outside, there should be sufficient ventilation if I've got a mask on. But what I would add to that is if you're huffing and puffing, you're exhaling, that's going to come out of that mask. So that's going to decrease that, it's going to increase that distance. So that's another reason why when we are doing the work that we're doing sealing masks, such as an N95, so that nothing can get in, even if we are closer than the social distancing. Does that make sense? Now, if you're just wearing a surgical mask, and you're huffing and puffing, stuff's getting out and things are potentially getting in. But if I'm working and I am exhaling or exerting myself, I would have a sealing N95 mask or better on.
Very good. I appreciate that. The question that I actually wanted to ask is in relation to when do we go to the store to pick up our stuff for the next day? Or for that day. On the checklist, it talks about doing this in the afternoon. And this makes a lot of sense to me because we're not going to be bringing the contamination that happened within the store to the client's house immediately. However, some agencies might be in some patterns where they've been picking up stuff in the morning for decades. That's what works for them. Besides, the store is full of staff and employees at that time in the morning, and they're also full of products. Would it be safe to say that in some situations, the agency needs to figure out where the least amount of risk is and not necessarily go in the afternoon?
You go, Rebecca.
This one's all me.
Well, I got my ideas, but let's hear what you have to say, and then we can have a conversation.
It's a good point that you make, Troy. And admittedly, yes, there's a risk assessment that has to be done in that as well. We've already seen that big box stores like Lowe's and Home Depot, even when they're at only 20% of their fire occupancy, they can potentially have upwards of 500 people in the store. And depending on your region and the level of infection, that could mean that you're walking around with any number of infected individuals, whether they're asymptomatic, pre-symptomatic, or currently symptomatic.
Semi-symptomatic.
Omnisymptomatic, yeah. Omni-infectious.
Yes. Polysymptomatic, we'll just go off. Anyway, so yeah, there's a calculated risk there. And there are some places we've talked about that are offering curbside, but that means that you're going to spend more time putting in the order online. Some places have pro desks that you can call in your order. A lot of times that's more smaller local stores, which, yay, local business. But yeah, in the morning, there tend to be more people on staff, and you know that the shelves are going to be more fully stocked. So I can see the draw there. But the reason that the stores are more fully stocked and have more staff there at that time is because there's usually more people there at that time. That's when so many of the contractors are trying to get in and out before their day starts. So I think it does kind of depend on what your local store is like and what you consider your risk to be your workers. And if they're taking it cautiously and they're wearing their masks and they're washing their hands and they're disinfecting, as appropriately, then I think, yeah, morning can work, but the checklists were developed to try to be a best practice. And so that's where we're saying, if you can think ahead, if you can plan ahead, which is what so much of this is look at your assessment, figure out exactly what you need to do inside the house so that you only take in the tools and equipment that you need. Plan ahead. If you can do that, I think afternoon is worth a shot, personally. Janet, you said you had an opinion too.
Well, I would say you have to look at your local situation and look at where you're at in the curve in terms of how much COVID is out there. And if you're going up and you're high on the curve, you want to minimize contact with people, period. So you would want to implement in your planning curbside pickup or any other kind of tasks that are available to you, online ordering, minimize contact with other people, especially strangers, okay? If you cannot do that, then you want to implement a disinfection protocol after you pick up stuff. Now, the other issue that comes in here is COVID on surfaces. To date, we have no information about transmissivity of the virus on surfaces outside of a medical context. Everything we've got is on the medical context. So I have not heard, and I've been watching for any situation where people have gotten COVID from a package. And I'm sure Amazon is looking for that too. So far, we haven't heard any reports of that. Okay. So those are the things you want to put in that risk assessment. So if we're in a bloom phase, if you want to call it, then you want to minimize contact. If you're at the bottom of the curve or lower parts of the curve, the situation might be different. But you could also implement, when you get back in the car, you're going to disinfect your hands, and you should be okay. Wash your hands. Not just gel them, we mean wash your hands before you get to the clients, or right after you get to the clients, before you touch anything, and we set up outside and we set up the hand washing. Wash your hands. That should be good.
Thank you.
So that brings up my question, which is to glove or not to glove, right? We got all this contradictory stuff about using gloves. Are they better? Are they worse? What's the deal with gloves?
No impact. In fact, it can possibly spread the infection faster.
You're just putting on another layer of skin.
And now if someone had an open wound, for example, someone cut themselves, or when we do construction work, we bang up our hands sometimes. So I would I would put a glove on that hand or whatever, but the misconception is the glove is protecting me yet again. And as we always, and the other thing is, there are gloves that we use in this work anyway. For example, our leathers when we're doing some of the work. And I don't want people to forget that you still have to wear the hand protection for the task that you are doing. And I don't want you to take a contaminated gloved hand and stick it into a leather. So there's a lot of other issues that go into this when you remind people that when they're out there to break the chain of infection. You do not want to touch something and then transmit it to another surface. So the wearing of gloves is psychological for some people, I think. Okay. I look at it practical. I watch what the guys are doing and how they're using their hands. And that's another awareness that if there's a positive out of this pandemic situation, is people are paying more attention to where their hands and their feet are. And that'll be a good thing for safety overall. Did I answer your question?
Yes, thank you.
Gloves? Nope.
Okay, I think we have time for one last question. So let's do one from Troy.
Okay, so what I'm thinking is that we have deferral policies in place. And one of the things on the checklist is in regards to the office and the procedures in relation to listening to the client concerns. And this is during possibly during the intake or whenever the office is interviewing the client for the job. And I think this is really important. It's an important step. However, it could lead to a slippery slope. Most agencies have very strong deferral policies on when they decide that it's time to defer the client based on the agency's concern of the client. How do we go about determining when a concern turns into a deferral based off the client concerns? At what point do we know that this person is asking questions beyond what a normal person would ask, and this could potentially turn into a lawsuit type of situation that is going to take a lot of time to resolve?
Lawsuits can happen anytime, even if you did it right. Go ahead, Rebecca.
But I think Troy's right. Some people just throw out red flags, right? If they start hinting about litigation or about you're going to pay if you don't do this right, that can become a
big red flag.
Big red flag. And and it's hard because when you defer somebody, you got to be able to justify it to your Troy. This was one that I had to because they were threatening to sue us, right? So deferrals are hard because you've got the scrutiny of the agency and DOE coming at you if you do it wrong, and we certainly don't want lawsuits for being discriminatory, or so it's a tricky one, but that's right. Your life is just wasted when you're stuck in lawsuits.
Right. And I'll defer to Rebecca and Amanda on this, but one of the things when I'm talking to someone, you can get an idea when you're talking with them as to where their questions are coming from. Are those questions coming from a fear factor, that they're just trying to make sure that what's going to be done to their home is protecting them and their home? Or if they're fishing for a potential lawsuit to, benefit themselves in some way. And you already have more than decades of experience with those types of situations. Is that correct?
Yes.
That hasn't changed. Okay. So, I would rely upon the voice of the person and how they're asking the questions. And I believe there is, in your deferral protocols, there are some options that you might want to review and think about. What would you say, Rebecca or Amanda?
Now is not an ideal time for me to answer because I have screaming going on in the background. So I'm going to mute myself again real quick.
Okay. How about you, Amanda? Based upon your, you talk to everybody across the country. What do they use, their deferral procedures?
I think the deferral procedures that you'd use for COVID-19 concerns with clients would be same as any other reason for deferring. As far as all of the different red flags and things you'd have to write down to justify it. Troy, do you have further comment there, seeing you're the person that reads all of this?
What I would rely on is the fact that we have written into our state plan, and many of the states would as well, that when a client is being uncooperative, that is a reason to defer them. And if we can't even get through the first layer of intake questions because of how seemingly obnoxious the person is being, that could be considered uncooperative, and the agency would, at that point, want to defer that client. I don't know if that could lead to possible discrimination or not. That's a good question. However, I think that would at least slow things down and get the person to think a little bit about their behaviors and how they're treating the agency, and whether or not these types of things that they're bringing up is worth being deferred or not.
Mm-hmm. Well, when you look at the record across DOE of deferrals and the potential lawsuits, have you seen any patterns in that? Troy?
I haven't looked at the record in lawsuits nationally.
Mm-hmm.
Perhaps somebody else has, and that's a very good question and something for us to explore.
I think that would be at the next level up question as to what trends they have seen that could give us advice down to Rob's level as to what to do. Would you think so, Rob?
Yeah. I mean, obviously that's a big thing that DOE does for us, right? Is they've got a pulse on what's going on nationally, and they can give us heads up when they're seeing trends like that. Mm-hmm. Well, any trends in how we're implementing this program nationally.
Right.
So we've been going for about an hour, so let's wrap up. And any final thoughts from any of you or comments?
The checklist is extremely valuable, and it's asking us to do things in a way we've never done them before, and that's hard, right? And so one of the things that we're doing in New Mexico to kind of emphasize that is we've got a weekly call where we're kind of asking each agency, how are you doing? How are things going? What parts of the checklist are working? What parts aren't working? So it becomes an opportunity to get a pep talk and also to recognize where the holes might be, right? So I think that's one of the things we're doing really well in New Mexico. That we used to have a monthly call in on technical issues, but now it's basically how are we dealing with COVID, and we're doing it once a week to just make sure that we're all on the same team and putting these new work practices into place.
The thing about the monthly calls or the weekly calls is we are keeping that to 30 minutes. That seems to be a threshold. Once it is longer than 30 minutes and it starts to creep towards an hour, people tend to drop off and they're not as likely to attend. Right. If you know that you have a 30-minute meeting and it's going to stop at 9 o'clock or whatever the end time of the meeting is, you're more likely to be there. It's just human nature, and we look forward to it. It's condensed. There aren't very many silent, awkward pauses, and we get a lot done, and we go through a lot of information in that time period.
The comment I want to make that I forgot to make early on is that the COVID-19 class that we developed is now available also in Spanish, and it is also free for anyone who works in weatherization. They go to litmos.com, which is the NREL learning management system. And these checklists also will be available in Spanish, and they, by the time you're watching this, will also be available, and they're freely available around the country through the Building Performance Association. And I think E for the future. Other comments?
I think I would put the comment that these new procedures are probably going to be with us for the next 18 months to 2 years if past pandemic experience with pandemics is reliable, and this is going to be a new normal for everyone, and they're going to have to be a lot more careful and pay attention to the details. And this is serious stuff, and I hope that people understand we're doing this to protect them as workers and our clients.
And one more thing that our organization has done is we've taken these checklists and we've put them on an online portal so that our guys in the field can actually fill out these forms on their phones instead of having 17 pages of forms to fill out. And so I think that, the more that we make it easier for the crews, the more likely they are to comply.
I'll actually feed off of what both Rob and Janet said. I think the reality is this is a new normal. This is what we're going to be doing for, yes, the next 18 months to 2 years. But I think some of these processes are actually going to help us well into the future beyond that. There's new technology out there that we can take advantage of, and we can limit exposure. We can limit liability by doing more things remotely. And I think the more that we can embrace that and roll with it, the more it's going to help us for the long term.
Yes, agreed. I appreciate that, Rebecca. That's still true, and a lot of us don't think that this is a marathon. This is not even only a marathon; it's an ultra marathon that we are in for. 18 months to 2 years is a very long time. However, that gives us time to develop these habits. And by now, it should be habit for most of the network with these procedures. If it's not, then the sooner you wrap your mind around the fact that this is not going away soon and this is the new normal, the more capable you are going to be to handle it.
Mm-hmm.
Great. So I guess this wraps up the session. Thank you, everybody. Guess that's it.
Good job, guys.
Bye, everyone.
Thank you.
It's a nice discussion. Yeah.
Great.
Thank you.